let's look at the African traditional society long ago,
yes,
versus today's modern world.
yes.
Back in the days, there were very few cases of infertility, unlike these days. Could there be something triggering it out? Could it be the feeding? Could it be the environment? I don't know. What could be the cause of this?
So it's a mix of things, because first of all, the question is it true that there are more cases of infertility now than compared to in the previous seasons? The answer is yes and no, because initially we didn't have very good
medical
tests, and so many of these cases were going around without being noticed, and many people were not showing up for your tests, because most people would prefer to go for traditional checkups and those things, and people had their traditional solutions,
traditional ways of handling
their
own
so you find a man, this lady is not getting pregnant, he gets another one like that. But it seems that if you look at it also, it may be true on the other hand, because now the social structure, the people's social lives are changing. Women are delaying to conceive. This is the thing. Initially, people used to get married at 18, 20 years
and
of
they
age.
give birth immediately.
Yes. So now we are on average, first birth is coming at 30 and 32. That's almost in the evening.
The evening days of our life.
Yeah, so that delay is significant, because along the way you get other problems. So it could be a mixture of things and a number of variables there. People are getting more aware, so they are going for treatment, but also people are delaying to conceive, and that has an impact on their fertility as well, especially for the ladies. Yeah.
So how about in the men?
In the men, yes. So in the men also a number of things are changing as well. We talked about mumps infection as one of the causes of male infertility, things which can disturb the sperm. But also lifestyle is a very big factor. A number of men are going on recreational medication for recreational purposes. And in our population, you will be surprised, a number of these men who look very masculine and doing a lot of aerobics, some of them are taking medications which do affect their fertility. You find they are on testosterone-containing medication, which enhances their male masculinity. Their masculinity is enhanced, but it drops their sperm count on the contrary. And so they they may be sexually okay, active, but the sperms are few and they're not functioning well. Yeah. So recreational medication, even smoking is
basically drug.
Yes.
Drug use.
Yeah. Smoking and alcohol, all these things are affecting. Yes. Of course, men are delaying as well to marry and have babies. For the men, the issue of the sperm count dropping in relation to their age comes a bit later, in their late 70s.
Yeah, sure.
Yeah, so, but their behavior, the social behaviors, alcohol consumption, smoking, recreational drugs. Recently, people are beginning to take shisha, and the shisha has many of those things in there. So that might be another thing to look at. Yep.
I understand. Thank you so much. So how does a man know that they have low sperm count?
Oh yes. So again, you can't tell it from the outside. You have to analyze the semen. That fluid which the man releases at ejaculation has to be analyzed in the lab to see the density of the sperms, to see the structure of the sperms, to see how the sperms are moving, and we can do some extra tests to assess the ability of those sperms to fertilize.
Okay.
So that has to be done in the hospital.
Okay.
But you can look at telltale evidence in yourself to see if there could be some problem. For example, if your testicle size is reduced, you can palpate in the scrotum and see that the testicles are smaller, or maybe they are softer by yourself, or they are painful when you touch. So those are signs.
Those are small indicators.
Yes, small indicators. Some people, their testes never descended. You know, by design, our testes are formed from inside the abdomen.
Okay.
and then they move out and enter the scrotum. So in an adult, you find the testes, the normal position should be in the scrotum. But you find in some people, the testes are not there in the scrotum because they got trapped on the way.
Okay.
Yes, what we call undescended testes.
Okay.
And so it's important for the parents to examine their male children
When they're still young.
when they are still very young, very, very early.
Okay.
But also it's important for the health workers who look after these children. When the child comes for pneummonia or malaria, you examine the whole child.
The whole body.
The whole body.
You don't only take a test for malaria.
Just don't do that. Don't care for the child on a pen. Just, okay, mother, what's the problem? You just write test. No.
Okay.
You have to examine this baby because you might be the savior of this baby's future.
Thank you so much.
Yeah.
We are talking about infertility, and doctor is trying to explain to us into details the common factors that causes a lot of infertility among men and women, and then also into the young little children. Doctor is still talking about you being very keen, especially the caretakers of the children, check the child where possible. Doctor, what are there some examinations that someone can take to find out if they have blocked tubes? Or to find out if they can't function well, or if they are infertile?
Yeah, so usually when a couple has an issue with the conceiving, the first thing is we have to identify the underlying cause. This is a must before even you give any treatment.
Okay.
Now, for pregnancy to occur, at the basics, 4 things must be in order.
Okay.
1, there must be sperms. 2, there must be eggs. 3, the tubes must be open because the sperm and the egg meet in the tube, as I illustrated. And finally, the womb must be fine. So these 4 things must be okay and working well. So if a couple has any issue with conceiving and they're not getting a pregnancy, those questions must be answered. So these questions are answered through tests.